Welcome back. February is American Heart Month, a time when people are encouraged to focus on their cardiovascular health. In this sponsored segment, we are joined by Dr. George Thomas and Mary Glasgow from Primary Care Plus to tell us about heart disease and how we can lower our risk, which is really, really important because this has been the leading cause of death in the United States for what, 100 years? I mean, a very long time. I think the first question is, doctor, what is heart disease? What are we trying to avoid?
Well, there are several types of heart disease, but the most common form is coronary artery disease, which is blockages that you get in the blood vessels that take blood to the muscle of the heart. So you get plaque formation that starts, in fact, even in childhood, and it progresses over the years, and finally, when you're 50 or 60, you get a heart attack. So you have to start managing the risk factors for heart disease at an early age to prevent a problem down the pike.
Well, and that's a really good point. Hearing you say that, you're thinking, gosh, what do I let my kids eat? Because as a parent, like, you're responsible for them in these early years. So Mary, what are some things that we are eating or feeding our kids that we should be a little more careful about?
You know, like red meat and, you know, definitely want to keep to your fruits and vegetables. What else, Dr. Thomas?
Yeah, so mostly you want to watch your fat, you want to watch your sugar.
Okay.
You want to try and maintain ideal body weight. And it's just common sense diet. You know, you want to stay away from donuts and highly processed foods and that sort of thing. Just a lot of common sense.
Yeah, so trying to eat generally healthy is going to benefit you and your kids in the long range. You said around 50, 60, people start having heart attacks, people start having heart disease issues. What are some of the symptoms? Because I know they can be different for different people, especially between men and women.
Right, right. In men, you get the classic chest pain in the middle of the chest that goes into the arm, the left arm especially, the throat or the back. In women, symptoms can be very subtle and misleading. It just might be a little nausea, vomiting, or you break out into a sweat, and it turns out to be a heart attack.
Really?
So it can be very atypical in women. So that's something to think about when you see people at home and you have symptoms that don't make any sense, like you have a meal and you start to break out into sweat, you take a couple of Tums, it doesn't go away, and symptoms progress, you go to the emergency room and get checked out.
At what age would you say you should start taking those symptoms, you know, seriously? If you're in your 20s or 30s, you wouldn't be thinking about a heart attack necessarily.
20s or 30s is very unusual. I mean, it can happen, but it's very unusual. Mostly in the middle years. And, you know, obviously men get heart disease earlier, blockages earlier than women do, because estrogen prevents heart disease in women. It's unusual in premenopausal women, but they catch up pretty quick once you hit menopause. So the risks increase significantly. And within 5 or 10 years of menopause, the risks are about the same in men and in women.
And Primary Care Plus is a great provider, a primary care provider. When you are having those symptoms, you need to go to the ER. But if you want to prevent those symptoms, you need to be regularly checking in on your numbers, checking in with a primary care doctor, correct?
Right, that's exactly right. You need to take care of all your risk factors. And those include, you know, high blood pressure, diabetes, high cholesterol, smoking, of course. Age itself is a risk factor because as you get older, there's a higher incidence of heart attack, and heart disease is more obvious than, you know, let's say when you're 75 as compared to when you're 40.
Sure.
And sex, you know, males are always vulnerable, more so than women, and so these are all the risk factors that you need to address. Yeah.
Absolutely. Well, thanks for educating us on that. Hopefully everybody eats a little healthier today and the rest of this month, trying to avoid king cake as much as we can, right? Yeah. Thank you, doctor. Thank you so much, Mary. Appreciate y'all coming on.
Right. Thank you.